Hi, Dr. Heather here from Wellspring Chiropractic Lifestyle Center. Today we're talking about low back pain. Did you know that right this minute, 1 in 3 people that you know is struggling with low back pain? And one of the common causes of low back pain is disc injuries. So I want to go over into the anatomy a little bit with you so you understand what's going on when there is a disc injury. So we have our stack of vertebrae that have discs in between them, and the purpose of the disc is to be a spacer to make sure that this hole is the right size in between the vertebrae so that that nerve has room to breathe to carry the messages back and forth between the brain and the body. So the disc is not a shock absorber, it's a spacer. It's actually a lousy shock absorber. And its purpose, again, of being a spacer means that it has to be healthy. And if it loses its health and it deteriorates, that hole gets smaller, and that starts to affect the nerves that are trying to carry messages back and forth. Now, the disc does not have a good blood supply. So the way that the disc gets nutrients in and toxins out is the same way a sponge works. When we squeeze a sponge, it pushes the water out. When we release it, it sucks the water back in. And so the disc is the same way. So it is movement of the spine that helps the disc to be healthy because it's a way for the body to squeeze the disc down and then release it, getting the flow of fluid in and out. Now, if you have a misalignment of the vertebrae, which causes irritation to the nerve and inflammation, the body is actually going to use your muscles to strap that joint down so it stops moving. And that muscle spasming that is strapping that joint down is also going to start interfering with the flow of fluid in and out of the disc. So prolonged subluxations or joint misalignments where they have that accompanying muscle spasm can actually lead to disc deterioration. Now, sometimes when we look at discs, we want to understand if there's a disc bulge or a disc herniation. What's happening there? Well, a disc actually is like a jelly donut. It has a gel on the inside, but it's surrounded by these fibrous layers. And these fibrous layers have cross-hatching so that one layer, if you think of concentric layers, one layer has fibers going in one direction, and then the very next layer has fibers going in the opposite direction, and the next layer opposite to that, so that they are layer upon layer having these cross-hatching. And so if there is pressure on a disc that causes that disc to bulge out, that will be caused by either impact injuries or from putting pressure on the disc and then twisting the wrong way. Many people, they blow a disc when they are bending and lifting and twisting something. And so we know that if we put the disc under pressure and twist it, those fibers can actually separate and the gel can be oozing through. When that happens, now that oozing through could be putting pressure on nerves and causing pain. We do know that we can do things that can help to realign those fibers and get the disc to suck back in. But first things first, we have to understand what's going on with each individual person. So we're going to be doing tests in the office to be able to identify exactly what is the cause of your disc injury and what do we need to do to help your body heal it. We're going to do a thorough history first because we need to look at what are all the factors that have accumulated over time that have landed you where you are right now. So there may have been past injuries that you've had, but you may also have bad posture and bad habits. And those are things that can actually put more and more pressure on the discs so that it sets you up for an incident to occur, which is actually just the proverbial straw. Once we find the history that makes sense to us of what has accumulated over time, then we're going to do very specific testing in the office. So the straight leg raise is a test that helps us identify whether or not there is a disc injury. And it will also help us to identify whether there may be, instead of a disc injury, maybe a sacroiliac distortion or inflammation in the area, misalignment, subluxations. So we want to identify, is this truly a disc injury or is there something else going on that's causing that low back pain? Because it will alter how we will proceed and how we will help that person. So we do our tests as well, looking at the nervous system. We'll use tests that the astronauts use to measure how healthy they are. And that includes looking at the nerve supply to the blood vessels, organs, and glands, and that can interfere with the healing process if you do have an injury. We'll look at the nerve supply to the muscles. That'll show us where there is spasming in the body. And then we'll also do some other tests that will look at posture. And if you are antalgic, which means you are in an altered posture because of pain, we can look at which way you're leaning. If you're leaning into the pain, it tells us about one type of disc injury. If you're leaning out of the pain, it tells us about another type of disc injury. So it gives us very specific information. And then we can look at ranges of motion as well, because that will show us where things are more locked up, where there is spasming and guarding in the body. Now, it turns out that just like cavities that seem to occur in the same places, because those are the parts of the teeth that you have the most difficulty cleaning, right? You usually get the cavities in the back of your teeth rather than in the front. Well, when it comes to disc injuries, there are certain discs that tend to be the culprits. And so in the neck, it tends to be that C5, C6 area, because that's where we should have a beautiful forward curve in the neck with lots of give in the spine. And that forward curve is our shock absorber. If we lose that curve and it straightens out, the brunt of that gravitational force is going to be right on that C5 disc. So that's the most common disc to have an injury in the neck. When it comes to the low back, it's actually the bottom disc in the lumbar spine, the L5 sacrum area, because the whole weight of the body is sitting on top of the sacrum, that whole stack of vertebrae, and that's the disc that is, those bones are nice and big down the lumbar spine to be able to manage that weight, and the disc should be nice and thick. But that's where the greatest trauma is going to happen when there's a disc injury in the lumbar spine, is right at that L5 sacral junction. So we do our exams to identify exactly what's going on, whether we can help. And when I study this information, I come up with a plan for you so that we can identify what exactly are the steps we need to take in order to help you resolve your disc injury. So that may include specific chiropractic adjustments using a very gentle approach. We may use levers in your body, which is using blocking of wedges underneath your pelvis and your lumbar spine that helps to realign things. It helps to traction out the joint to suck that disc back in. We also will use different exercises that we'll teach you to help you to do work at home to help resolve the disc injury. And then we're also going to coach you on certain lifestyle practices that are going to help you, looking at what you need to start eating, stop eating, any supplements that are going to help you deal with the inflammation, and how to heal those discs up in the fastest way possible. So when we put all that together, that's how we get our best results with folks that struggle with disc injuries that is causing low back pain. I hope that you found this was useful. If you did, please share it with others, and I look forward to sharing more with you again soon.